pleasure to be a part of second LOED International Congress on Longevity and Regenerative Therapies and Supplements. I'm here to share my views on mental health span, the missing pillar in longevity medicine. Just a quick overview about myself. I have been in this field since more than 2 decades now, and past 10 or 15 years, I'm mainly focusing my practice towards functional medicine and longevity medicine and helping individuals with chronic lifestyle disorders and what key lifestyle changes can give rise to healthy aging and a long life. So, few of my accomplishments, I have been awarded as a mental health and diabetologist in Delhi NCR, and I have um, done various courses in longevity medicine, functional medicine, and some meditation certifications as well. So this is just a disclaimer that this talk is an informal educational purpose only and does not constitute medical advice, diagnosis, and treatment. All right. So let us dive into the basic framework. And this framework, I feel, is the backbone of anyone, for any health practitioner who is involved in providing care and support and well-being. So, as we know that talking about a human being, whenever we are encountering patients or whenever we are considering about health span, longevity, which means that healthy aging, which means that towards the maximum capacity, all the organs and the functional systems of the body are working and in synergy with each other. So this means that if anyone is seeking a medical advice, it is because they are facing some symptoms or some complaints physically. So we know that if we have to investigate anything, that is on a physical level, we need to investigate on a subtler level. So we move towards the microscopic, biochemical, and neurotransmitters and the blood workup, pathology, imaging. To address the cause on the physical level, we move towards a microscopic level. Then, this is a well known fact that the thoughts and emotional realm affects the microscopic, the hormones, the chemistry of the body. Suppose if a person is in an angry mood, the neurotransmitters like adrenaline, noradrenaline secretion increases in the body, which changes the chemistry, and then this has an impact on the physical body. Similarly, if a person is in a calmer state, the serotonin or the well hormones increase in the body, which reflect again in the sense of well being, joy, and happiness in the physical body. So, now taking a step deeper, we know that there is an energy that makes us feel alive, awareness, consciousness, whatever we call. And whenever there is any problem in the body or anything that needs to be achieved in life, then that energy we call attention moves into that and the work is accomplished. So, this is the basic framework for the genesis of the disease, also, that from the subtler to the grosser level, the disease is manifesting. And similarly, if we have to restore the health and well-being of the person, we have to move on the same ladder. So just addressing the problem, physical problem at the physical body level, we are just using a banded approach and trying to just do fine tuning at the physical level, but that is not of a long-term help. So for that, all these sciences, functional medicine, longevity medicine, has come up to address the same framework and how to strengthen it in terms so that it can give us more health and well-being. So diving deeper, we see that mental health affects longevity. Affecting longevity means that it increases if the mental health and the mental well-being of the patient is not maintained, then this means that there will be accelerated aging in that individual. That means that the maximum capacity of those organ systems will not be continued at a longer time. So, how these things are getting reflected from the mental to the physical, we know that there is chronic stress and inflammation triggered because of mental ill health, which increases the aging process. We know that the gut brain axis and the microbiota can get disturbed with your thoughts, emotions, if they are not in synchronized or in a regulated way. Then again, this increases the oxidative stress and mitochondrial dysfunction, which leads to accelerated aging and senescence of cells and various organs. Then the next is hormonal imbalances. We see that the stress hormones, cortisol levels, adrenaline, noradrenaline increases in the body, the level of insulin goes high, the levels of testosterone and the sex hormones goes down, growth hormone levels goes down, and this leads to metabolic syndrome, insulin resistance, PCOD, diabetes, and metabolic syndrome and various dysfunctions. All right. So this is just elaborating those steps that prolonged stress and depression increases the cortisol levels, which again activates the hypothalamic pituitary adrenal axis. And these elevated cortisols or the stress response is manifested as a low grade inflammation in the body, in reflected as raised IL-6, interleukin 6, TNF alpha, and CRP levels in blood workup. And this chronic inflammation accelerates cellular aging, increases mitochondrial and DNA damaging, and both reduce the health span and the longevity. Similarly, the disturbances in the gut-brain axis and the microbiota, this stress alters the healthy bacteria composition, which reduces the beneficial bacteria like lactobacillus and bifidobacterium, and it increases the pathogenic bacterium, which decreases again the short chain fatty acids, increases the inflammation in the gut, causes dysbiosis and leaky gut syndromes. This also shifts the metabolism of various amino acids. For example, from tryptophan, rather than making more serotonin, it directs it towards pro-inflammatory pathways, and which increases the fire of chronic inflammation and leads to accelerated aging and senescence. Right. So similarly, oxidative stress, mitochondrial dysfunction, which increases again which are increased by emotional stress, reactive oxygen species, and depletes oxygen defenses like glutathione and coenzyme Q10. Hormonal imbalances, we have seen that chronic anxiety, poor sleep can disturb melatonin. Melatonin is important hormone which also has many anti-inflammatory properties and anti-aging benefits as well. Growth hormone is a hormone that improves longevity. It has been seen in various studies. Thyroid and sex hormones again are getting imbalanced because of increased mental stress. And insulin resistance is again next, which leads to metabolic dysfunctions like PCOS, diabetes, and various other health issues. They are even involved in various cancers. Breast cancer, colon cancers, and prostate cancers are again having deep connection with mental stress. All right, let us understand this, that what is happening when we say that the person is stressful. We have seen the chronology of the ladder, the physical, the emotional and mental, the biochemical, and at the energy level. So, if the person is feeling some symptoms of agitation, restlessness, depression, anger, and all these things, then what is happening in the biochemistry of that person? So this red dot that we are seeing here, this is the locus coeruleus or the switch in the brainstem area. which is the fuse which starts firing whenever there is a fight or flight response. And this increases the output of noradrenaline. Noradrenaline just prepares the body how to deal with stress. It stimulates the spinal cord, the preganglionic sympathetic neurons, and prepares the body, decreases the blood supply to the various internal organs, directs it towards the body organs to prepare it for fight or flight response. Then we see that the frontal or the prefrontal cortex that is responsible for awareness and various cognitive functions, this also gets inhibited because of increased noradrenaline. The noradrenaline is also affecting the limbic system, which is involved in the fight and flight response, and which triggers the emotional output and the old memory patterns that fuel the response as it has been in the past. So this area again, limbic system, amygdala increases the fear, anger, and hate emotions in the survival mode. So, and finally, the hypothalamus increase the output of various hormones from pituitary, which releases cortisol and various stress hormones. So this is a broader area, or the broad outline, how the body and the brain is getting prepared in terms whenever this stress response is happening. And as in terms of, we have seen that chronic inflammation, acute inflammation is beneficial, but if that inflammation is not set off, then the chronic low grade fire deteriorates and destroys the body. Similarly, in this case, if this locus coeruleus and this once this thing is continuously on the go, and this noradrenaline is not getting cleared, and dopamine, serotonin, and the other hormones are not kicking in and releasing the frontal lobes and switching it off. This continuous state of fear, fight, and flight, we know in our daily interactions and relationships how we are behaving and how we are interacting, which leads to, which is a manifestation of this low grade inflammation of the fire in the brain. So just understanding this nervous system, we have seen that in the brain, the main areas which needs the focus are locus coeruleus, hypothalamus, and the limbic system, and which triggers the sympathetic nervous system. Sympathetic nervous system is for the fight and flight response, and the overflow of stress hormones and chronic stress buildup leads to a continuous mental disturbances. And this is the way how it is affecting the longevity and the health span of the individual. So there is a healthy system as well, which is known as the parasympathetic system. Parasympathetic system, the 90% of the parasympathetic system is governed by the vagus nerve. So vagal nerve, you can say, is divided into two parts. Just to say that if you take diaphragm as the sectional area, then one is above the diaphragm and one is below the diaphragm. So ventral vagal is the uh, part of vagus nerve which is involved in social engagement, regulated nervous system, cheerful, you are more resourceful, you are more engaging in the society, and you are a benefit and resource. And dorsal vagal is the part of the vagus response which is more, you can say, in the chronology, more rudimentary in the chronology, which once this sympathetic nervous system of fight and flight gets exhausted, then there is generally freeze and shutdown of the nervous system, and unable to hold or unable to process the functioning of the nervous systems. Right. So this is also elaborated in polyvagal theory, the three states of nervous system. One is the safe and social ventral vagal, which is the parasympathetic, which senses the safety, connection, calm environment. You are grounded, you are open, connected, and relaxed, and the heart rate is slower. You are having a calmer breath, and this promotes social engagement, healing, rest and well-being. So basically, this tunes the system in such a way which increases the health span and the longevity of those individuals. Then fight and flight sympathetic response is something which is in which you are perceiving the situation as a threat. So you are dealing it in two ways. Either you are dealing it as taking it as a threat, taking it as a threat, or hating the situation. If you are your main dominant response is hating it, you are in a fight mode. And if your main dominant area is fear, then you are in a flight mode. Freeze and shut down, as we mentioned before, is the dorsal vagal part, lower branch, where oh, when this thing is continuously happening, fight and flight, and things are getting exhausted, then over the period of time, you become helpless, numb, and this low energy and hopelessness and all these things kicks in. That is basically as a protective response to conserve energy, and this deteriorates the functioning and the response and the interaction in society. All right, so whenever we are dealing in our day-to-day life, we are either coming from a place of a regulated nervous system or from a place of a dysregulated nervous system. So from a place of a regulated nervous system means that if there is any stress or if there is any important thing that needs to be done, and we are shifting ourselves in a sympathetic drive, sympathetic mode of functioning, we are doing the work, and then that sympathetic is getting shut off. We are either getting back in the ventral system, and this way we are moving to and fro from one system to another. But the problem starts happening when you are getting stuck in one system and you can't easily switch from one system to other. So how the basic these are the cues to know in which state you are in a particular time frame. So suppose if you are in a regulated nervous system, you means you are mainly rooted in the ventral system, and the individual feels calm, present, emotionally connected, and on the emotional levels you feel compassion, gratitude, joy, and these are the things. And if you are coming from a dysregulated nervous system, that is the culprit for chronic stress, difficulty in navigating our lives, works, relationship, and increases the burden of chronic diseases. Then it feels anxiety, irritability, restlessness, panic, anger, and a sense of being under pressure and hypervigilant and unable to slow down. Right. So why understanding this is the solution? We know that there are various sciences and various therapies available to address your mental well-being and indirectly affecting the health span and the longevity of the individuals by balancing the mind and the mental well-being. So suppose if we talk about the visualization therapies, acupuncture is trying to release the spinal cord from the effects of locus coeruleus. Yoga therapies, body, chiropractic, massage, all these things are trying to diffuse the locus coeruleus and decrease the burden of noradrenaline. Suppose we are giving some nutraceutical supplements also. So the main function of that is how to get the noradrenaline, adrenaline flushed out from the body, how to increase the metabolism, how to rebuild the stores of glutathione and the normal chelators, the methylation and everything, so that this washout happens. And how then the second part is how to restore the restorative hormones like serotonin, GABA, and more restful hormones. So and then the behavioral mindfulness based therapies directly work from the prefrontal cortex, and from prefrontal cortex they increase the dopamine, serotonin, which then inhibit the noradrenaline and the locus coeruleus in a bidirectional biofeedback mechanism. Then this is it. All right, so we have seen that we need to restore the brain and the nerves. So first is that how we can release the grip of locus coeruleus on spinal cord and body. For that, there is inner body awareness meditations, massage, then emotional freedom techniques are there, acupoint tapping is there, then releasing the grip of locus coeruleus on prefrontal cortex. There are various mindfulness based cognitive behavioral therapies. Then empowering the prefrontal cortex and turning off the limbic system. There are various awareness based practices, breath awareness, sense portals to shut off the limbic system and directly tune into the prefrontal cortex. Then various Sufi meditations, jap, and mantra chanting, metta, loving kindness meditation, even music and various sense portals can also release you from the grip of the limbic system. And then there are various investigative, introspective practices also, mapping awareness, where sensing in where you are at this moment in terms of your nervous system mapping. Then rain meditations. Then how to restore the nerves and the autonomic nervous system. There are various grounding techniques, forest bathing, aromatherapy, mud bath, inner body awareness, yoga, tai chi, qigong. And the last is the most important part is you need to regularize your sleep so that the sleep is more restorative and the detoxification starts happening then. Finally, we see how what on what basis are the workings of your nervous system happening. So your nervous system is responding to the internal listening, how you are processing the whatever sense stimuli you are getting and how you are processing that. That is the internal listening. The outer listening is what stimulations are coming from the outside, in which type of environment you have placed yourself, and then listening in between means how that information is getting processed and what type of conditioning you are in and how you are releasing that. And what is the thing that the nervous system wants to convey through this listenings. It needs to understand whether whatever the stimuli that is coming, whether they are welcoming stimuli or they are warnings. Then it is always watching for signs of safety, connection, and how it can engage in a better way. All these things are basically working to set off the fire of the brain and improve your mental health and well-being. Right. So if we see the basic framework of any meditation practice, so suppose you want to start a meditation practice, then the first thing is to arrive. Arrive means let your attention sink, bring your attention wherever it was into this moment, and how you can bring it into this moments through sense perceptions. Look around where you are, sense where you are sitting, what sensations you are having, what sounds you are getting, and it is pure sense perception. There is no labeling of whatever you are sensing. Then we set the intention that why are we practicing any meditation. We remember what was the state of our mind when it was agitated, and we know how short lived our calm and peace are, and what is the tendency of this mind to get again and again into a dissatisfactory state. That brings up our intention to sit and cultivate a peaceful and a calm mind. Then, whatever meditation practice you are using, you will start that practice. And then finally, it is important to savor the benefits of the practice in terms of sensing the peace, joy, calm, well being, because this helps in neuroplasticity, developing new brain connections and reinforcing those connections, and those things make new neuronal circuits, which takes your awareness run in newer directions and to cultivate a positive change and a happier mental well-being and a mental state. So finally, there are some supplements. So the role of these supplements are to decrease the effect of the stress hormones, how to increase the calming hormones and the calming neurotransmitters, how to decrease the effect of chronic inflammation in the body, and some antioxidants to decrease the oxidative load. So ashwagandha, rhodiola, theanine are good stress related supplements that decreases the effect of stress, decreases stress hormone levels. Green tea has longevity benefits also. It helps as a anti-inflammatory also. Lavender is calming, it increases the serotonin. Tryptophan again is a precursor for serotonin and increases the calming hormones, neurotransmitters. GABA, magnesium helps in various uh, you can say the chemical reactions in the body, and again it's a calming thing. Omega 3 is a very good anti-inflammatory. Vitamin D again has many anti-inflammatory benefits and many longevity benefits also. And then reduce ultra processed and reduce intoxicants so that this doesn't contribute to more inflammation in the body. So to set up a daily meditation practice, in a body awareness, a movement-based practice like Vipassana or Tai Chi, Qigong, awareness-based practices like again Vipassana, sense perceptions, daily journaling and introspections are important to know your mind maps where you are at this point. Similarly, investigating those mind maps in cognitive behavioral therapies help to release yourself from that grip. And right meditation is like tasting a sweet. There is no need to chew or chase. You simply place it on the tongue and the sweetness unfolds. In the same way, when you sit with the right practice, peace, calm, and joy begin to rise effortlessly from within. And to savor it gives you the new intention to move into the practice further. Continue to trust the process and trust yourself. Thank you, friends. Thank you for your attention.